We're still celebrating Pride for the rest of this month, but there's still a lot of work to be done when it comes to acceptance. So joining us live to talk about this is Ariella Cuellar with the California LGBTQ Health and Human Services Network. Good morning to you.
Good morning. Thanks for having me.
I know one of the things that you're working on right now is to try and expand equity when it comes to healthcare access for LGBTQ plus folks. And while you're doing this, you took a survey of some of these folks, and what did you find?
Yeah, so the research we conducted showed that there was undoubtedly a need to expand coverage and improve access to healthcare. So the California LGBTQ Health and Human Services Network utilized a platform called Qualtrics to find out what kinds of barriers LGBTQ people are facing, continuously pulsing residents in community town halls, local pride events. And one significant statistic we found was that 9% of lesbian, gay, and bisexual people experience discrimination and or harassment from a medical provider. And for transgender people, it can be as high as 29%, which is pretty outrageous.
Well, that is outrageous, and it's interesting because the wording is discrimination. So that is someone actively saying things or creating a barrier for you when you're receiving healthcare. But I know there's a lot of LGBTQ people who don't receive outright discrimination. They just aren't treated in the way that they need to be specially treated because the provider doesn't necessarily know to treat them in the way that they need, that their life needs.
hmm Yeah, that's 100% right. Like sometimes it is the provider who's just genuinely making, an honest mistake or just genuinely doesn't know. So what we're doing is we're actually currently trying to pass the TGI Inclusive Care Act, also known as Senate Bill 923, which can definitely help with, finding in-network providers who offer gender-affirming care services, and also providing that cultural training to providers to just, expand their knowledge, expand their affirming care practices to transgender, gender nonconforming, and intersex folks.
It looks like you got a lot of funding for this as well. Where is that coming from, and how are you going to use that?
Yeah, so the funding is coming from the LGBTQ initiative, so the lesbian, bisexual, transgender, queer initiative. So that will help address gaps in knowledge and research. It will award grants to fund innovative demonstration projects, promote improved cultural competency in California's healthcare system, to fund other local public outreach and education efforts. So the state of California has dedicated $17.5 million of their budget directly into this initiative through June of 2024. So this will significantly help reduce disparities among the most vulnerable, including LGBTQ people of color, elders, and young adults.
Ariella, I'm so glad that this work is being done. For a long time, the advice was always just get a gay doctor, but that's not enough because
Right.
there aren't enough gay doctors to treat all of the LGBTQ community. We need everybody to be on board, and hopefully this will be a step in that direction. Thanks so much for doing it, and thanks for talking to us.